morning, everyone, and welcome to this week's FHS seminar. Our guest speaker today is Dr. Ian Pike. His talk is entitled Social Marketing to Reduce Serious Injury in British Columbia. Ian Pike is a professor in the Department of Pediatrics at the University of British Columbia and the director of the BC Injury Research and Prevention Unit at BC Children's Hospital Research Institute. Dr. Pike is also the co-executive director of the Community Against Preventable Injuries, which is an innovative social marketing organization working to change attitudes and behaviors toward preventable injuries. He has been recognized as an expert in injury prevention and social marketing and has conducted over 100 interviews with local, national, and international news outlets on topics including drowning prevention, fire safety, road safety, work-related injuries, and unintentional poisoning. He holds master's and doctoral degrees in the science of physical education, sport, and recreation. And after completing his master's degree and his PhD at the University of Alberta, Dr. Pike led the Lower Mainland chapter of the Canadian Red Cross before joining the University of British Columbia in 2004. Thank you, Dr. Pike, for accepting our invitation to give this talk. We are very happy to have you here with us today. So a kind reminder for the audience that the seminar will take around 45 minutes and we will keep the last 15 minutes for Q&A. The floor is all yours.
Thank you very much indeed for that kind introduction. It's a pleasure to be here. And I'm going to jump right into my presentation because I do have a number of slides that I'd like to try and get through and some material that I'd like to talk to you about. So as introduced, the presentation is about social marketing. I think as injury prevention professionals, we're all very familiar with the 3 E's around how we prevent injury, education being one of them, being required but not sufficient in and of itself. Social marketing is an expansion of the educational component of injury prevention, and that's what I want to talk to you about today. Arrow down to advance. Thank you. So in this presentation, I'm going to spend 30 seconds to talk about what exactly social marketing is beyond public education efforts, because there are some distinctions that need to be made. And then I'm going to walk you through our example of social marketing in British Columbia, a campaign called Preventable. And that is not only the call to action of this social marketing campaign, it's the name of the organization that we've set up with the single focus to run that campaign as well. We'll talk a little bit about the problem that we're trying to address in British Columbia, some of the issues and the opportunity as we saw it as an organization to address injury prevention, what the campaign is exactly, and how effective have we been? We've been in the market now continually since 2009. And so we have some good experience and some good metrics to try and present to you. So first of all, let's just answer this question quickly. What is social marketing? It is the use of commercial product marketing to promote, rather than a product, it's to promote a behavior. We're asking individuals rather to consider their current behaviors, and through the efforts of social marketing, we're asking them to adopt behaviors that would improve their own health, their family's health, or the health of society at large. And so the whole objective of a social marketing campaign is to produce a social good. Okay? I think we're all very familiar with anti-smoking, anti-tobacco efforts, okay? Those are social marketing efforts that have been in the marketplace for 30, 40, 50 years now. I'm going to say, though, social marketing in and of itself is what we deliver. But as a process, it is not a standalone awareness-raising campaign. It needs to be coupled with other issues. And these, of course, are the other two E's. Environmental changes, infrastructure changes, policy changes, and the enforcement of those policies on occasion. And so social marketing, while it's quite glamorous, and as you'll learn, it's not inexpensive, is not a standalone tool, but it provides a framework that allows us to combine classical marketing efforts with theory and knowledge. And those theories typically come from the areas of psychology, sociology, economics, and they're focused on people's understanding and behaviors. They're not easy to implement, as we've learned in our efforts to try and do this. We're often trying to change intractable behaviors. Asking people to behave differently around their own health, safety, and well-being is not an easy challenge. We're often working in complex environments and usually with very, very limited resources. Injury prevention doesn't enjoy the notoriety of some other health-related matters that receive far more resources than injury does. And if you're working in the area, I think you will readily identify with that. Within social marketing, there are factors to consider. And the 5P framework is one that's quite often talked about. You need to develop an appropriate product. What is it that I'm going to give to this audience that will cause them to reflect on their current behaviors and hopefully make a choice to a new behavior? That product needs to be delivered to people at the right price. We all understand when we go to buy a new pair of running shoes that it has to fit our budget. When we ask people to change behaviors, it also has to be delivered to them at the right price. And typically that means an exchange. They're not paying money to receive your information and change their behaviors, but they are typically asked to make an exchange. What will I give up now to adopt the new behavior in the future? It has to be easily accessible, and so therefore the placement of any messaging or product is very important to consider, particularly when you're going after target populations. You have to know where they'll be looking, where they'll be reading, where they'll be listening, so that your product is placed in those places. And you have to elevate people's understanding of where it is. So you have to promote the fact that it's coming, that it's here, that it was here. And so these are all very important points. And quite often with health-related information, and in particular injury prevention, it quite often needs to be coupled with policy changes or policy supports. Of course, like any sort of implementation process, there's a cycle. These are the phases of social marketing that are typically described in the literature and ones that we've learned and implemented in British Columbia. It's important to describe and define your problem. What exactly is it that we're dealing with? And how will we go about trying to make changes? Crucial to social marketing is that you know your audience. You cannot sell anything to anybody if you don't know what they will pay and what they're looking for to buy. The same is true of social change. You cannot promote social change unless you've completely understood how the audience will consume your messages and how they then might be motivated to change. You've got to understand the strategy that you use, so the what and how. Adapt the marketing mix, which is the 5 Ps, the price, product, place, and sort of mold them to fit the particular circumstances of the campaign that you're looking for. Obviously, you must evaluate this. These efforts are, as I said earlier, not inexpensive. When people make investments to assist you with a social marketing campaign, they expect that you can give them feedback about how the program is being implemented, how well it's performing, and how well it did summatively. And then, of course, you'll need to implement the intervention and the plans at some formal launch. Usually, social marketing campaigns are not effective with a silent, in the middle of the night launch. You need to sort of raise people's understanding that it's coming, that it's here, and that they generate some excitement about what it is you're presenting. So in Canada, the problem that we're dealing with is one of injury. In Canada, it's been referred to as Canada's invisible epidemic. Like most countries of the world, our leading cause of death for Canadians aged 1 to 44 is injuries. And among some child groups, it represents more than 50% of the cases of death. And so it's the leading cause of death for children beyond all other causes combined. It is not a trivial matter. It is a huge public health issue in our country. And in British Columbia in particular, it is the leading cause of death for that age group. We wanted to try and intervene. We wanted to try and take the next step and implement a social marketing campaign to address this invisible epidemic in Canada. Just to give you some of the numbers, in British Columbia, in any typical year, and these are averages from the last 20, 2,000 people will die from injury. About 30,000 will require hospitalization, and about 350,000 will be injured severely enough to require ambulatory care at an emergency department. There are, of course, an additional, we don't know how many, that visit family physicians, walk-in clinics, or deal with it themselves, in particular sport-related injuries. And so the numbers are huge. The economic burden of this problem in British Columbia is $3.7 billion annually, increasing to $6 billion if you add in the costs of road-related injury and work-related injury, both of which are paid for by third-party private insurers, but who pay the bill to the healthcare system. And so it's up to $6 billion a year. And if, like me, you cannot imagine what $6 billion looks like piled in the corner, it's about $400,000 to $700,000 an hour, or $7,000 to $11,000 a minute, 24/7, 7 days a week. It is a huge amount of money. And it's not limited to British Columbia. Healthcare consumes these kinds of dollars everywhere, and injury is a huge cost related to it. And of course, what we all know here is they're preventable because they're predictable. And if we can get in front of that, we could eliminate many of these costs. And it's not a saving, it's an avoidance of a cost because that money will go somewhere else in the system, but it could be made available to others. More importantly, we could prevent injuries that result in more than 9,000 permanent and partial disabilities each year. As people who work in injury prevention, you will recognize that we know the epidemiology of injuries. We've been describing it for 20 years now. And we wring our hands at how bad it is, and we continue to describe it. I think we also know how to intervene. We've got enough research. We have good texts. David Hemingway's While We Were Sleeping, if you read that book, it tells you that we have been as successful as we possibly could. It's time for us to roll these interventions and solutions out and for us to act. And so our effort is part of trying to act to intervene on injuries. Of course, we know prevention is the key. Primary prevention, as far upstream as we can get it, is the solution. We know that there is a very good positive return on investment. This is work that's been done and tabled for years and years and years, that when you invest $1 in any of these primary preventive efforts, these are the types of return that you can realize, which are then translated into cost avoidance in the health system. And I think any of us looking at this table would be very glad if our dollar in our investments made anywhere near these kinds of returns. And so they're highly positive, and we should be thinking and adopting, and how can we put in place these kinds of interventions to result in these kinds of returns? As a huge example, the average cost of a bicycle helmet for a child in Canada is about $30. The Canadian Institutes for Health Information, which is our national body that gathers all of the health data from across the country, computes costs and ROIs and everything for the healthcare sector in Canada, will tell you that the mean daily cost for a brain injury survivor who's experienced traumatic head injury is on average about $2,800 a day. Okay. You can see for one $30 investment, the return on investment is about $2,800 a day for a brain injury survivor. This is not trivial. And we therefore need to be promoting the use of bicycle helmets at all times by all riders in all infrastructure. And why we're not doing that simple messaging and simple requirement through policy and enforcement is something that we should really ask ourselves. You know, lots of times people say, oh yeah, helmets, we've been there, done that, didn't work, or we couldn't get people to wear them. Oh, this is significant enough reason in my mind to continue to try. It's a known solution. And as Churchill said, never, never, never give up. Keep persisting with what you know works and find new ways to promote the way in which it can be taken up. So just to remind ourselves, we know the solutions in injury prevention are these E's. 3 E's, 4 E's, 5 E's, some people have listed 7 E's, however many E's there are, they tend to fall into these categories. The preventable social marketing campaign is clearly situated in education and social marketing. It does not work in isolation, however. It must be and is coupled with the other E's. And we work in partnerships, multi-sectoral, multi-ministry, multi-jurisdiction. The partners are essential to this campaign working, and it requires resources. And resources are not always dollar signs. It's people's time, it's people's talent, it's access to organizational communication channels and customer bases. It's using other people's infrastructure to the advantage of the campaign. And of course, it requires all of the factors around research, advocacy, persistence, as I've said. And so there's a lot that has gone into thinking about how this program will be developed and implemented. So preventable, as I said, is a social marketing campaign. When we established it, we thought it would work best if we set it up as a not-for-profit organization with its own board of directors and investors. And it would only do one thing, and that is develop and deliver a social marketing campaign, period. If you look at other injury prevention organizations, how often do you see them stretched across trying to do some of this, trying to do some training and education and workshops, trying to intervene in the community, trying to intervene with professionals to... Their budgets are spread so thin They do a lot of things well, but not excellently, because they're trying to rationalize across all of these things. Our thesis was one thing, do it as absolutely best we can, and partner with other organizations who can do the other things. So Preventable became this organization. We are a registered not-for-profit organization. We established in 2007 and launched our campaign in 2009. As I've said, we have this single focus, and currently there are more than 100 organizations who are part of our network. Some of them are a big part because they're board members, they're founders, they're investors. Others are more peripheral, but nonetheless important to the delivery of this campaign, particularly if there are specific components of a campaign with whom we partner. A good example is we are in the market in the summertime around water safety and boating safety. The Canadian Coast Guard and the Royal Canadian Marine Search and Rescue, they're essential partners, as you can imagine, but for 2 or 3 months in the summer. That's it. And it's a wonderful partnership. The mission is to transform societal attitudes toward injury prevention such that we can reduce the human and financial burden of injuries in Canada. The social burden of injuries is the bigger concern for me. When I look at the fact that injury takes more lives of people 1 to 44, what I'm most troubled about is the lost potential. People not realizing their life streams, not becoming the professional engineer, the physician, the scientist, or whatever they wish to be. And it's that lost potential that is so concerning. So the issue that we were dealing with, and between 2007 and when we launched in 2009, we spent 2 years in formative evaluation. And because of the generosity of our investors, we could spend $1.5 million over 2 years learning from British Columbians what their attitudes, what their values were around injury prevention, and importantly, what they would react to and what would resonate with them in terms of an injury prevention social marketing campaign. And so we spent that time. What we learned is people's attitudes are a huge concern. We would talk to people and they would say, well, Ian, what are you going to do about it? Injuries are inevitable. Look, you live, you get hurt, get over it, was the prevailing attitude, which is okay if you skin a knee. It's not good if you have a spinal injury. And what are the circumstances that lead to a skin knee versus a spinal injury? I mean, Barbara Marangiello has tried to research this question for years, and she says they're indistinguishable at the outset, which is very troubling for us because you could be minor, but it could be major. And our attitude about which we enter into these circumstances where there's risk is really important. And an attitude that says, well, it's inevitable, is something that we would like to try and have a conversation with and like to try and address. The interesting point was the person who said, you live, you get hurt, get over it, was the same person who said, but it doesn't happen to me. I know how to drive while I text. I know how to go into the backcountry of British Columbia and ski in an avalanche zone safely. You know, so it's these kinds of inconsistencies in people's minds that we wanted our campaign, A, to try and raise to the surface. And then if they were prepared to look in the mirror and reflect on some of those attitudes, then we could have a conversation and try and change some of those issues. So attitude was something that the campaign launched on. So the opportunity, as we saw it, was to raise awareness, start a discussion, start a conversation with British Columbians, all of them. Our target market being 25 to 54-year-olds. And part of our strategy was, if we can reach 25 to 54-year-old individuals, we may also affect their children's behavior. Because as we know, child injury prevention is in huge part about modeling and about supervision. And so if you can get those people to change, perhaps their children will also change as a consequence. We wanted to create an injury prevention brand. If you have looked at healthy lifestyles and across the development, Canada was known in the 70s, for some of you, you weren't born then, but in the 1970s, there was a program called Participation. It was about promoting physical activity as part of a healthy lifestyle. And it got traction. People loved it. People started to go out jogging. People started to lose weight. They got active. And so it met all of its objectives. The brand was a little trifoil logo. At one point, market researchers in the 70s determined that the Participation logo in Canada was more recognizable than the McDonald's Golden Arches. That was an accomplishment. When my partner Kevin and I decided that we were going to do this preventable campaign, our aspiration was to be as good as preventable, or as good as Participation, pardon me, to create a brand and recognition by the citizens that was immediately recognizable. And as soon as they recognize the brand, the messaging pops into their head. Okay? So that was our aspiration. Of course, we want to transform people's attitudes and their behaviors. We need partners to leverage that because we are well-resourced, but not well enough to try and change the attitudes and behaviors of 5 million people who live in British Columbia, and a vast geography. And Kevin will tell you, because his background is marketing. He's a marketing guru and commercial marketing, product marketing. He wants us to build a community of divergent interests coming together around a single issue under a single banner using a single approach. So I should have quotes on that because that's Kevin's statement about what we're trying to achieve here is getting people around the campfire to have a conversation and a sing-along, as we say. It's important to recognize, though, where we are and where we were at the start of this campaign. So let me just explain this continuum. On the top, above the orange arrow, are in white language, is various social marketing issues that you would recognize. So cell phone driving, drink driving, seat belts, climate change, these are all social issues that to a greater or lesser extent are messaged about, there are campaigns about, they're appealing to you to do better. And underneath is about, in the yellow, is about the length of time that those efforts have been underway, generally speaking, in Canada. In the blue are the stages by which we sort of determine the success of engaging a community in a campaign, from completely low awareness and unengaged, don't know about it or not interested, right through to mass engagement. The important thing to recognize about this is it takes time. You cannot expect to implement a social marketing campaign and say at 12 months, well, I'm sure looking forward to these results because they're going to be so exciting. Yeah. If you have got anything along awareness and engagement 1 to 4 to 5 years in, that would be successful. Okay? it takes a long time. Why did we put all this together? We put it all together because our investors needed to know how long this was going to take. Business people think in 4-year cycles as a maximum, right? If I haven't achieved anything in 4 years, it was a failure. Well, not so in this case. We're moving. And as long as we could show that we are progressing along this continuum, there was going to be continued investment. So this was a very important sort of baseline conversation to have with the investors. And of course, this is where we started. The aspiration was to move to the right. Theoretically, we looked at many behavior change models, and we liked this one, the health action process approach, Schwarzer's model, because it spoke very clearly to how we were trying to think about our audience, where our audience was, and how we wanted to move them to self-efficacy around injury prevention. Where preventable really focuses is at intention. We ask people to think about where they're currently at. What do you intend to do because of the message that we've given you? And then get into the action planning and into the initiative of behavior change. So, as I said earlier, we spent 2 to 3 years in formative evaluation. We gathered more literature and readings and information from people. We traveled around the province doing town hall meetings. We surveyed everybody to death. And at the end of all that, we tried to make sense of what we had as input. We took a whole bunch of baseline measures, which included sort of your standard knowledge and attitude surveys. We gathered all of the hospitalization and health data that we could. And we wanted to know that we were making a wise investment with other people's money. And so therefore, what are some of the economic metrics as well? I think it's important to highlight the fact that focus groups and iterative conversation about what our campaign looks like and how it will roll out are essential. The campaign creative, and you'll see a little bit of it, is iteratively developed. We never produced anything until we've focus group tested it to pieces. Why is that? Well, again, this unfortunately is about investment. It costs us about $300,000 to $350,000 to produce a 30-second ad for television. We don't spend that money until we're pretty darn sure that the actors and the camera and all that, before we call them in, that it's actually going to resonate with people. So there's a lot of storyboards, there's a lot of paper mock-ups, there's a lot of work with citizens before we actually call in the crew, as we say. And so, but the iterative nature of that is also very helpful to us to have a continuing understanding of people's attitudes and behaviors as they go along. So what does the campaign look like? Our objectives, as I've said, behaviors, brand, discussion, and provide individuals the opportunity to join a movement, to be part of something new, to influence themselves, their own family, the neighborhood, their community, to be an agent of change themselves. The dosage, as I've said, it's annual, ongoing, iterative. We have to achieve something in the media called gross rating points. What that is sufficient, I'm blanking on the word, sorry. People have to be exposed, thank you. Sufficient exposure so that the messaging will resonate with enough people in the community to then have an effect. If you are thinking about a similar kind of campaign development and implementation, and you cannot afford to reach the threshold of gross rating points necessary, don't do it. It's wasting money. You have to go beyond this level of exposure. once you've gone beyond that level of exposure, you can expect returns. This is how marketing works. This is how Nike sells running shoes. This is how every product is sold. They just raise the awareness, and we are a bit like sheep. Oh, that's good. I think I'll go and buy one of those. You know, and it doesn't work quite that easily with social marketing, but it is a necessary threshold to reach. We use multimedia channels, so TV, radio, social, written, out of home, which are posters, bus shelters, billboards. Our campaign is seasonal to reflect what are the activities and the injury risks in the 4 seasons. We do lots to earn media attention. So we don't pay for everything. We try and make our campaign, as they say, sexy enough so that the news want to interview us. That's why are you doing that? Can I come and do an interview with you? And so that's part of our strategy as well. And as I've said, partnerships are key. Monitoring and evaluating this, it's a repeated measures design. When we first launched, we were so nervous about whether we were on track and would be any kind of successful. We polled representative samples of British Columbians weekly for 6 months because we were frightened. We're now pretty comfortable with how it goes. So we poll representative samples every 3 to 4 months. And so we have this repeated measures design that allows us to compare those exposed to the campaign who've reported they've seen it or they recognize it with those who report no exposure. We can also track the population over time en masse and look at the longer term changes in awareness, attitudes, self-reported behavior, and try and tie some of these outcomes to any changes in injury-related deaths and hospitalizations. As I've said, mass media, digital, all of these channels are used. And is there audio on this? Okay, so this is just something we call a sizzle reel. It's clips of what our advertising looks like to the consumer on TV and out in the community. And I'll let you just see it. It's about just 2 minutes of a compilation. So this is the website. So I'm going to talk about that. Before I move on from the creative, you'll notice in here, there is no blood. There's no injured people. There's no parents wringing their hands, going, oh, there's no crying. Our audience in British Columbia said, do not take us to the dark place. Do not show us scenes of grieving parents in an emergency room waiting room. Don't show us blood and guts. Do not show slow-mo of people flying around inside cars. We don't want to see that. If you want to get our attention about injury, let us fill in the blank. Let us get to that place ourselves, because it's horrific. And that's our audience. We listen very carefully and don't take them to the dark place. They said, if you take us to the dark place, particularly if it's about our kids, we might watch it once and it'll be horrible. And then I'll push it out of my mind. And when I see your brand again, I won't look at it because it's too horrible. And so this was a huge learning, because every other campaign in the world has used slow-mo, grieving parents, gravestones. I mean, I'm hoping they did their own research and that's what their audience told them would resonate. Ours did not. Ours is from a completely different point of view. And they asked that we treat them as intelligent individuals who know what to do, who need a reminder. It was fascinating in our focus groups when we spoke with people. So what about water safety, for example? Parents, in particular mothers, could cite every rule verbatim from any pamphlet that you'd ever given them. The question was, so do you always behave like this? Well, no, sometimes I get busy, I forget, I get excited, we all get going. So it's that prompt at the place and the time when risk is highest that this campaign is trying to target. It's trying to let them fill in the blank at the end, come to their own conclusions about what they don't want to have happen and what therefore they should be doing. So how effective have we been? Well, we've got a database that's in excess of 15,000 people now, and it's evenly distributed about males, married people, those who are employed, and parents. We know through tracking, and we employ a marketing research company to do the tracking of people. Like, I'm sure you've been phoned to say, have you seen this ad on television? What can you tell me about it? We employ a company to do that. Okay? So they give us all of the marketing metrics. We know that we reach about 2/3 of the British Columbian population on an annual basis. And we also know well over 1/3 of our population, or our audience rather, have completed university and have a higher income. So we still have a challenge to reach lower socioeconomic status neighborhoods. We're reaching the neighborhood, we're not resonating with them giving us their information or agreeing to be part of the surveys. That's our challenge. Okay? We know that we get exposure, but getting feedback is a little bit more work to do. We reach about 2.5 million customers, pardon me, multiple channels of communication, and we generate over 100 million media impressions a year. What is a media impression? It's the opportunity for one person to see the message once in a year. So that's what an impression is, and there are 100 million of those. And since we've started, campaign recall since 2009 has increased by 40%. So when we ask people, have you seen this campaign? What can you tell me about it? That ability to recall has improved by 40%. And there's no fatigue. Advertising, people go, oh, I've seen that one, yeah, I'm tired of that one. Ours, it's called flighting them. We put them on, we carefully monitor. As soon as there's any fatigue shown, we pull it. Because we've invested 300,000 in that. We want to be able to air it again in the future. And our camera crews have done, our creative people have done very well. We can, the middle stays pretty much the same, but we've got flexible front end and flexible conclusions. So it looks a bit like a different ad when it comes back again. And then you can recycle them in the future. Of those surveyed, preventable campaign, you can see the percentages in terms of support, trustworthy. And what I want to point out is these are advertising industry norms for all advertising, not just social marketing, for all product and social marketing. These are the norms, and those are we're significantly higher. Our advertising agency tells us, boy, this is a campaign that punches well above its weight. So you've got something going on here. Keep the formula. Like, don't be tempted to change it. Never give up. Be persistent. Continue to go at it. Those who've seen the campaign score significantly better on measures of awareness, attitudes, and behaviors. And there's a positive shift observed in attitudes in the general population of greater than 10%. I'm going to just pass over these. Please, if you wish, you can look these up in the literature. They've been published. Peer-reviewed articles showing that we are having an effect on people's attitudes. We are having an effect on people's behaviors as measured by cycle helmet use in this one. And that we do understand that people see different kinds of injuries with different preventability indexes. This piece of research showed that, in fact, transportation seems to be more preventable than others, but the gap's very, very narrow if you've seen our campaign, whereas the gap's very, very wide if you haven't, which means that we're raising awareness of injury prevention that previously wasn't there. As I say, please have a look at these. So just want to finish up now. How does our campaign relate to some of these outcome metrics? Well, in deaths, our target population is in orange, and in blue are their children, 0 to 24. Significant decreases, pre to post campaign, 40 lives saved, mostly young children, cost avoidance about 26 million. The curve for hospitalizations is more dramatic, pre to post, significant proportionate reductions, and fewer hospitalizations at about 14 million, 15 million saved. The curves were on their way. Even with 15,000 data points, we haven't got enough for causal inference analysis to be completed. So we're still working to gather more data so that we can actually make some attribution of these decreases to our campaign, because we don't have a design that allows us to look at whether the campaign caused any of these changes. The way Kevin explains it to me, and he's far more pragmatic than I am, Ian, even if we take 5% of these reductions in death and hospitalizations, our case is made. Our return on investment is a wash. It was a good investment. Is it reasonable that we have a 5% influence on these numbers? That's up to you to decide. We think it's reasonable. The people we speak to in British Columbia, who are the sponsors and the investors, they think it's reasonable. And until we have enough data points for some better analysis around causal inference, then we can make that more definitive. So what can we do about all this? What does it tell us? I think I sort of sum it up by just saying, look, as injury prevention professionals, we can use our voices to raise people's awareness. We can do it through these kinds of campaigns, but we can do it one at a time as well in conversations. And we need to share generously what we know and what we understand about how to prevent injuries. When I were a little boy, my grandfather always used to say to me, son, keep your eyes and your ears open and keep your mouth shut. Okay? So the first thing to do is to listen and understand. It is imperative in a social marketing campaign that you listen and understand what the heck the people know, would respond to, and would resonate with them. Otherwise, it's wasted time. Coming in as the public health expert, and here's another pamphlet, is not in our view, how to do this. You've got to meet people where they are at. And where they're at, with understanding, allows them to be moved from that place. Creativity, strategy, these are essential components. You have to. And if you haven't, if you say, well, I'm not a creative person, you know, creativity doesn't just happen. It's a discipline. If you read Edward de Bono, Six Thinking Hats, that is about creativity. It's a mechanistic approach. So if you have not, read his book. It's simple. You can be done in one day, one evening. Follow some of the ways in there that he suggests how you can challenge yourself to think more creatively than you thought possible. There are some magnificent ways to be creative. Open to possibilities and opportunities. Don't close any doors in front of you. Don't say, oh, well, we're public health. We only work with these kinds of people. No, 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 no. Work with anybody who wants to help you with your mission. Okay? And remember why we are all here. Before I leave that, I'm just going to make one anecdote. Preventable works with the BC Liquor Distribution Branch. And other public health officials look at me and go, oh, what? How can you stand up and be? Well, in British Columbia, the BC Liquor Distribution Branch must, as a consequence of being in business, must deliver a message of moderation. They must tell the customers, buy this beer, but drink responsibly. Well, their messaging campaign was not good. And they knew it, and they couldn't get a good one. We knocked on the door and said, we think we can do this campaign better. Would you give us the chance? And now we have a long-lasting partnership with them. We focus on seasonal drinking and activities, so winter sports and the beer after the skiing, and summer sports, the beer and the boating, right? So it's those two campaigns. We're all very, very happy campers. And liquor distribution has deep pockets. You can spend their money on doing public good. Okay? And for us, we recognize the ethics, the ethical dilemma of many, but they have a responsibility to deliver moderation message. We'll do it for you in a much better way than you were doing. So this is what I was talking about in terms of my trouble. This is why we're here, I think. It's to preserve potential. This was a high school exercise that we did with kids about why injury prevention was important. And that's all we asked them. Why is it important? Come up with something creative to indicate to the world why injury prevention is important to you as a class. And this is what they came up with. I got to tell you, I cried. That is overwhelmingly why we're here. And for all of us, as Dr. Zeus said, you know, unless someone like you cares a whole awful lot, nothing is going to get better. It's not. It's for us to care and to do. Thank you very much. I apologize, I ran on a bit.
Thank you, Dr. Ian. The floor is now open for questions. Yes.
Thank you. Thank you very much. That was inspirational indeed. I come from an occupational health background. My name is Rima Habib. in this field, in the occupational health field, we always find it more effective to make it structurally difficult for injuries to happen. So, I mean, there are 1,000,001 examples. I don't have one on top of my mind right now, but in your work, do you think it's more effective if you follow that path as well, like you make it more difficult for an injury to happen rather than relying on people's awareness or relying on people's lifestyle behaviors?
Yeah.
And so on. So could you tell me your experience about this?
I can. Yeah, it's an excellent question. I stated a couple of times that our campaign exists and focused on people's attitudes and behaviors, but it's done in combination with the other E's, structurally making it more difficult for an injury to occur. It's paramount. It's really important. We advocate for separated infrastructure for cyclists and pedestrians from cars, as an example. Like, it's more difficult for a pedestrian to get injured if they're not close to a car. So, and home safety related things, barriers to prevent out of bounds skiing and snowboarding. These are all absolutely essential and necessary. But people are interesting because they will climb over the fence to get into the backcountry to go skiing. So, okay, if you're going to do that, recognize what you're doing, recognize the risk, and take steps to perform accordingly to mitigate those risks as far as possible. Like, we are not in the business of being killjoys and bubble wrapping people. I want people to experience life to its full. I want them to experience that thrill of it being a bit risky. But I want them to do it knowing what the risk is and have taken steps to mitigate as far as possible. Yeah. Does that answer that one?
Thank you. Thank you for this very interesting presentation. So my question is on fundraising and investors.
Yeah.
So we know that usually investors invest in the second E and not in the first E.
Mm-hmm.
And this must have cost millions of dollars, this project and the association, especially that it is single targeted. It's only in social marketing.
Mm-hmm.
So how did you convince the investors in putting that much amount of money in this project, especially that we know to sell prevention, it is not
hard.
It's very hard.
Yeah, it's a great question. And we get asked this all the time. How did you do it? Well, I think Kevin and I are both pretty convincing when we get into a boardroom. We're not going to let the thing go. We'll talk and we'll answer the questions. How did we do it with this group? We appeal to the organizations who are investors. We appeal to them on their sense of right, their sense of delivering something of added value, not only to their customers, but to their own employees. And so Preventable has a workplace initiative called Preventable at. So Preventable at London Drugs, for example, is a province-wide pharmacy chain. They're one of our partners. And what they did was they said that their internal health promotion and safety program was a bit weak. Could we develop something for them that looked like the Preventable campaign? And so employees would see this in their living rooms at home, come into work and see the same branding and similar messaging around workplace health and safety. And so it's a value add for companies that work with us. We can give you Preventable at. But a lot of it was the ability to give value add to their customers and their employees. That was the case. We also showed them that you might be a private company and you might think that we have a free healthcare system in Canada. Nothing could be further from the truth. And here's what health and ill health and injury costs your organization on an annual basis. And we just went to their controllers, got all of their public information, and built a business case for each organization that we talked to. And then we found out some interesting stuff about particular companies. BC Hydro is the utility that makes and delivers electricity in British Columbia. We went there, we thought we'd go there thinking, well, we should sell them on the electrical safety and all that stuff. Do you know what their #1 concern is for BC Hydro? Drowning prevention. Drowning. They're scared to death of drowning. Why? BC Hydro uses hydroelectric dams. They have to back up the water. In order to back up the water and create a lake, the government has says you can do that, but you must make that lake and maintain it as a recreational site for the citizens of British Columbia. So an electricity utility knows all about electrical safety. They're very, very worried about drowning because they have to maintain these sites. And so we could sell them on assisting them with drowning prevention messaging at their venues. They were on board immediately. As soon as we took that worry off their plate, they were in. Pardon me? Yeah, I'm not at liberty to say, I have NDAs about all the money, unfortunately. I can tell you we spend about $1.6 to $1.8 million annually on the campaign. And we've just been approved for an uplift now for the next 5 years to $2 million a year. So it's expensive. It's not cheap. But we spend 95% of that total amount on the creative. The staffing is done in partnership with the research unit. So they're my UBC staff. I think there's half a person paid for by Preventable. That's it. They don't have any offices or infrastructure or admin. They're located within the unit. So we've developed a very interesting strategic partnership between Preventable, the not-for-profit, and the University of British Columbia, as represented by BC IRPU. Everybody's happy because it's a good. The university likes it as a social good. And our partners like it because there's virtually no admin overhead. Then, well, there haven't been any drownings at hydro sites. There are drownings in other places because infrastructure, for example, in one area of North Vancouver, called Lynn Canyon, very, very fast moving water, very cold, and teenage boys like to go and jump off the cliffs and into the. So there've been drownings there. Yes, ma'am.
Very small question.
Yeah.
Thank you very much. That was really very informative. Yeah, regarding, the target audience that you selected was the parents' age, 25 to 54, and the trickle-down effect because they would influence their kids.
Mm-hmm.
This segment, how did you choose it? Just based on literature review and
No, we looked at the distribution of injuries in British Columbia. And you look at the peak of injuries and go, oh, that's them. 25 to 54-year-old men for the most part. That's
okay.
It. Yeah.
So, segmentation
yeah.
in social marketing is one of the
it's crucial.
tenets.
Yes.
Yeah. So is that it? Can you speak to segment just like that without doing any other sort of it was just who are the most effective segments?
These are the most effective. Yeah.
Their psychographics, their behaviors,
Well, we did. We spent 2 to 3 years speaking with them. Informative evaluation. That's right. Correct. Yes. Yeah. Yeah. We let the data speak to begin with, and then we went out and talked with that particular segment of the population.
Yes.
Yeah.
Yes. Okay.
Yeah.
Hello.
Yeah.
Thank you. Again, very interesting. I want to talk about context here.
Yeah.
So you're bringing the example of British Columbia with all the investments, and so great work, lots of lessons to learn from. At the same time, if you take this outside Canada, I don't know whether it's even outside British Columbia, thinking about Lebanon, our region, where the context changes. And so again, the message that could be sent here is a little bit depressing. It's like, oh my God, if in British Columbia, where there are regulations, I assume there are good roads, I assume there's some maintenance, I assume there's electricity, and there's all of this. You bring it to Lebanon and the region, and a lot of this infrastructure and enforcement and regulation is weak, or at least not enforced. And at the same time, when I listen to all the investment that has to go into this, it becomes quite challenging. So what practical lessons can we draw, or you can share with us, to countries that are less resourced and living in challenging resources? You've mentioned the low resource there, but I think the low resource in Canada is different than the low resource outside in the global south. So what are these sort of messages one can say, this would work in any place? This might be an overkill for you, or you cannot pay for it. But these are the sort of the hardcore messages that one can take and to other contexts.
That's a great question. So to answer the first part, preventable has been tested in other countries. It has been tested and implemented in New Zealand by their accident. That they have a single insurer for all injury now. So that one, and they've branded it a little differently, but it was preventable. It's currently being tested in Western Australia. It was tested and implemented in the province next to us for a couple of years, but their dependence on oil, once the price of oil dropped, their government let go a bunch of things. What about lower resource countries? So I've just returned from working in Japan, where we have a social marketing program in the planning there. They're not going to be able to resource it in this way. There's just no investment in the way that we have in. So we've considered, how do we influence a target market with messaging? And in the case of Japan, we are looking at parents and caregivers of children who are of booster seat age. For a developed country, they only have about 50% booster seat use. So they have some behaviors they want to change. We've already acknowledged we will not be able to mount a social marketing campaign that includes television advertising. And if you look at our resourcing, the TV advertising is what consumes it all. So if you take that away, what can you do? Well, you can find communication streams and channels to whom the target audience listen and who are influential. So in the case of Japan, we are entering now into an agreement with the Japan Pediatric Society to update their recommendations around car seat and child passenger safety, and to train every pediatrician in the country to deliver patient counseling at the time of health checkups for children. So that'll be how we deliver the message there. An influential individual speaking to the target market. The same training will happen for public health nurses and daycare workers. Japan is virtually every family is a two-earner family. And so children go to kindergarten and daycare de rigueur. So we can train the daycare workers. The other thing that we've done is we've found one organization who do have a little bit of resource, the Japan Automobile Federation. They want to be in the game of training car seat safety technicians. And while they're focused on the car seats and not booster seats, we've had an agreement just this last month for them to expand that, and we'll help them with the messaging. So the concept is we won't have lots of public messaging to the extent that we can get earned news stories, earned media, we will, but it will be through pediatricians, health nurses, daycare workers, and municipal news feeds. It was one thing that we learned because I thought in British Columbia, mummy bloggers, I don't know if you have them here, mummy bloggers who influence other mothers, they're a huge part of our campaign. We provide them with the content, they push it out to their network. And I talked about trying to do this in Japan, and people looked at me very puzzled. Mummy blog? We don't have those. But they do have municipal news feeds on social media. And YouTube is a huge channel. So how can we exploit that for our messaging? We can be every bit as creative in the messaging. We can be every bit as focused on getting people to think and to examine their own, to take the look in the mirror and say, am I doing this correctly? And we've appealed to some values that we know exist there, which is, as a parent in Japan, there's nothing more important than their children. And they are the protector. And so that will be the place that we come from in terms of the message. So TV isn't always it. We are on TV because we know how much North Americans watch TV, and that's a way to reach them during supper hour, news hour, right? But there are multiple other ways to achieve it. And I think that in a country like Lebanon, you think about what's my target market for a particular set of messaging or a particular initiative, and what are the influential communication channels that I might exploit? And how can I go get those people to bring that resource to me so that we can exercise it? Yeah.
Okay, we have one last question from Zoom, from Hussein Sibai. If you could unmute yourself and ask your question, please.
Yes, of course. First of all, I want to thank Dr. Pike for this informative webinar.
Just a second, let's increase the volume.
Yes.
Try to speak now, please.
Hello, can you hear me?
Yes, better now.
That's awesome. First of all, I just want to thank Dr. Pike for this informative webinar. And I want to really mention that I'm honored to say that Dr. Rana Barazi is giving us this semester a social marketing course, and which is why I'm attending this webinar and to get more insights about social marketing. My question for today is, in what ways can social marketing campaigns be tailored to reach underserved or at-risk populations, since we know that Lebanon is the highest country that has refugees per capita in the Middle East or in the world, actually? And what are some examples of these successful campaigns in this space?
It's a very interesting question. I will say what I know about refugee populations and trying to reach them with any kind of injury prevention messaging, I've learned from Dr. Al-Haj. We've worked on a few papers around the Syrian refugee camps here. I think I would sort of refer generally to my previous answer, which is determine what might be the influential communication channels that would reach people who live in a Syrian refugee camp. Because as I understand them, this is a central place, and you could think of it as a village that you could intervene upon with champions from within who are block captains and communicators. You could paper the place with posters and that kind of messaging. I think the most important is to go in and have a conversation with the population to determine where they're at and what would resonate. Because once you've done that, then there's all sorts of insights that you can gain that you can then put into place. So I don't have a precise answer. I'm not sure that other refugee communities have been addressed directly through social marketing. I'd have to go and look that up. But I do think there are opportunities, just as there are with any community, with any target market. But first, seek to understand. Go and converse, understand, and then try and translate that.
Okay, this concludes our seminar for the day. Thank you, Dr. Pike,
Thank
for this amazing talk, and thank you all for attending.